Hi, this is Dr. Hughes with Covenant Sex Therapy. I wanted to talk to you today about 4 important factors to consider when you're choosing a sex therapist. The first, training and experience. Is your therapist that you're considering trained in sex therapy? Do they have a sex therapy certification? Have they gone to many conferences related to sex therapy? Have they done any presentations related to sexuality or sex therapy? Have they taken courses in sex therapy? As I've talked before in other videos, not all therapists are required to take a sex therapy class in their graduate school. So has your therapist that you're considering taken a sex therapy class? Were they required to take one? A lot of graduate programs don't even require that the therapist take a sex therapy class. Now, I see that as a really big issue. If you have a therapist that you're going to and you're trying to work on this presenting problem, whatever it is, pain during intercourse or inability to have an orgasm, and your therapist hasn't ever had a course in sex therapy, they haven't ever gone to a sex therapy conference, they've maybe just done a couple of readings on the side and had a handful of clients that have struggled with sexuality, that to me doesn't sound like a therapist that specializes in sex therapy, and would definitely not be a therapist that I would choose if I was having such issues. So what training and experience have they had in graduate school? What training and experience have they had outside of graduate school in addition to it? Because merely taking a sex therapy class, in my opinion, does not put somebody in a good place to be a specialist or to be someone that's really well versed in sex therapy. So what have they done above and beyond if their graduate program required it, or if they took a sex therapy class in their graduate program? And then have they had the clientele, the adequate clientele to get competent and capable and comfortable in working with clients that struggle with sexuality? Have they had more than a handful of clients that have had erectile dysfunction or premature ejaculation? Or is that really all they've worked with? Just a few clients here or there that have struggled with sexuality. Because you want to choose a therapist that works day in and day out with sexual issues, or at least on a weekly basis with sexual issues, because it's kind of a different animal. In a lot of respects, it's a different form of therapy than general therapy. So that's the first thing. The second thing is you want a therapist that is trained in relational therapy and that has experience in relational therapy. How many clients have they seen, or do they see on a regular basis, where there's two people in the room, where there's the husband and wife in the room? A lot of programs don't require that the therapists get relational training. They have to get hours in doing therapy, but they can be individual hours. They can be all individual hours. So what graduate program did your therapist go to? What additional experience did they have in doing couples therapy or relational therapy? Now, I just got done doing a session with a couple just a minute ago, literally like 5 minutes ago. I'm looking at the clock right now. I've been doing this video for 3 minutes. I meet with couples day in and day out. So do all of my therapists. So when you're looking for a sex therapist, is your therapist trained in relational therapy? Have they had the schooling and the classes, the theory behind it, and then have they met with clientele so that they know how to work with couples? Because it's so different to work with an individual than to work with a couple. You're working with a completely different system. So that's the second thing. The third thing that you want to consider is the therapeutic alliance. Do you feel like you're able to connect and bond and feel close to the therapist? Do they get you? Do they understand you? Do you feel like this therapist is capable? Do you feel like this therapist is honest with you? That they're actually present and there in the room with you? And it's hard to gauge that without doing a couple of sessions first. Really, it's going to take about 3 sessions before you really feel like, yes, I have that with my therapist. But something that we like to do here at Covenant Sex Therapy is give you 10 to 15 minutes on the phone to talk to the therapist that you'd like to meet with, to fill it out, to see if you could possibly have that therapeutic alliance or relationship, because your comfort is going to be your comfort and connection, your therapeutic alliance with the therapist is going to be paramount in you getting the outcomes that you want out of therapy. The last thing, and I say the very last thing out of these 4, is financing. Is this therapist on your insurance panel, and how much does the therapist cost? So I'm not going to tell you what's a good price or what's not a good price, but that's the last thing that you want to consider, because we're all affected by finances. So unless you're independently wealthy or you just have a lot of money to blow, everyone's affected by finances. So the last thing that you want to consider is this therapist on my insurance panel, or how much does this therapist that's trained with relational therapy, that's trained with sex therapy, and that has had a good amount of clientele in both of those respects, how much does this therapist charge in relation to this other therapist, or is this therapist on my insurance panel? And oftentimes consumers or potential clients will get it backwards, and they'll look on their insurance panel, or they'll see how much therapists charge, and then they'll choose from there. And that really eliminates a lot of excellent therapists, a lot of excellent sex therapists, and reduces their chances of healing. I hope this helps. Thanks.